Coming up right now on The Doctors, where MD meets TV.
We have a home video from a woman who is also looking for options, but of a different kind.
Hi, Dr. Lisa. I am 32 years old. I have a son and a daughter.
Oh, she's almost beating you.
My husband and I are not interested in having any more children, and we definitely don't want any surprises. We don't want to use condoms. I'm not a good pill taker, and I don't want to go under the knife. So what else can I do for a more permanent birth control method?
What if I told you there was a brand new form of permanent birth control that didn't involve having your tubes tied or your husband having a vasectomy? We're going to scrub in and show you exactly what it involves next.
Basically, the procedure feels like a pap smear, it just takes a little bit longer. There might be a little discomfort like a menstrual cramp. I pass the instrument through the cervix into the uterus. There's the tubal opening right there. And we're looking directly into the fallopian tube right now. And now I'm releasing the micro insert.
My husband and I have decided that we don't want to have any more kids.
Did you guys tell scary stories?
Yep.
What kind of scary stories?
I definitely don't want to go under the knife. So what else can I do?
As every woman knows, birth control is a very personal choice with lots of options. But what you may not know is there's a brand new procedure called Essure. Our cameras followed Dove, a 32-year-old mother of two who's done having children, and she underwent this procedure.
What we're going to do with Dove this morning is the Assure procedure that feels like a pap smear, it just takes a little bit longer. There's virtually no discomfort, there's no incisions, and we put in a very, very small camera through the cervix into the uterus. Once I've identified the fallopian tubes, the small micro inserts will be put into the tubes, and then the procedure's done. Hi, I'm Dr. Mayer. How are you this morning?
Good. How are you?
Good. So I'm going to be looking inside your uterus, identifying the fallopian tubes, and then placing the micro inserts into the tube. Over the next 3 months, your body is going to form scar tissue that is going to completely block your tube. From that point forward, that you have permanent birth control. Okay, well, let's get you started.
All right, great. Thank you.
Excellent. You okay?
So far, so good.
Good. There might be a little discomfort like a menstrual cramp. I pass the instrument through the cervix into the uterus. There's the tubal opening right there. And there's the second one. The micro insert is going in.
You can see it on the monitor?
Yeah, it's fabulous. And now I'm releasing the micro insert.
Okay.
And I'm going to leave just a couple of the coils. There's a little gold band right there. I'm going to release it, and we got half of it done.
There's one done.
One is completely done. And we're looking directly into the fallopian tube right now. There's the other coil. I'm going to release the second coil, and we are totally done. You're amazing. Both of the micro inserts went in.
Okay.
They're in perfect position, and you're all set. So we're just going to have you rest for about 20 or 30 minutes.
Okay.
And then you can go home. Go about your day.
Definitely better than I thought it would be. Just mild cramping, period cramps. So I love it.
And we have an OBGYN here today, Dr. Mayer, along with his patient, Dove. And Dove just had the Assure procedure, right? This exciting new procedure that is being done out there. And how do you feel? You just had this yesterday, right?
Yes, yesterday. I feel fantastic. I had some mild cramping after the procedure, but to be completely honest, I don't like pap smears. I'm really scared to go to the GYN, but it was fabulous. It was
fabulous.
Great. It was like period cramping.
And you do this right in your office, right?
Yeah, that's the benefit of this procedure. It's done, the Assure is done right in the office. It's a permanent birth control method, and there's no cutting, there's no general anesthetic, and it's done under local.
And there's no cutting because you go in with the scope through the cervix.
Exactly.
Right?
We go through the woman's natural pathways, the cervix and into the uterus.
And you didn't feel anything when he did that?
No, it was just mild cramping, like period cramping. That was it. It was really easy.
And that special instrument called the hysteroscope that you use, you can see that in the video that you got to see yourself getting the procedure, which is kind of cool.
That was really
But we actually have an animation of that to show. If you could just tell us how that really works so we can see everything, that would be great.
Absolutely. So below is, we're going into the cervix, the uterus, identify the fallopian tubes. The coil is now placed on both sides, and it's left in place.
And how does it work?
Well, and then what you saw there is then the body naturally forms a barrier, and that blocks the tube.
So you have to wait a little bit of time after the procedure before you can, use it as contraception.
Right. The nice thing about the Essure procedure is there's a confirmation test. It's done after 3 months, and it lets me know and the patient know that the microinserts are in the correct position and that the tubes are permanently blocked.
Now, this sounds like every woman should run out and get it, if she wants permanent sterilization. It used to be tubal ligation or vasectomies. I still think vasectomies for the guy is one of the best.
Better idea.
Yeah. It's still quicker and easier.
Leave the babies.
Exactly. They should do something.
But like you said earlier, that's a personal decision, and couples make that decision. But once a woman knows that she has done, has her family complete, and whatever that means to her, that it's a perfect option.
Right, but this isn't without risks, right?
Right, but no, it's not without risk. It's very, very minimal. I don't perform tubal ligations anymore. If a patient wants that, I tell them to go elsewhere because I don't think the risk is worth it.
This has less risk than tubal ligation just because of the anesthesia part, or because of the...
It's actually dramatically less because there's no incision, there's no general anesthetic. Anytime you make an incision and go into the abdomen, there's a risk
that you're going to, for the
infection,
there is a small
bleeding
risk
bowel.
Of uterine perforation,
Absolutely.
Right? And that's putting the instrument right through the uterus.
Right, but hysteroscopes, it's a 5.5 millimeter scope, so it's tiny.
What about the risk of ectopic pregnancy or pregnancy outside the tube?
It's very, very small. In the clinical studies for the Essure procedure, there were no pregnancies.
But that's a good question because scarring of the tubes is what causes ectopic pregnancy.
Right.
But we're left with after the confirmation test, we are left with the fact we know they're blocked, so we know there's no recanalization that often occurs
Completely blocks the entryway into the uterus.
With that little coil, right?
Right, and this is the coil right here itself.
How does a woman find a doctor that's doing this?
Right, there is a certification process. I do want to point out that it's been FDA approved for 6 years. Worldwide, there's been 220,000 women that have had the procedure. And you just need to find a doctor that knows the procedure.
So it is FDA approved, so
Correct.
That's what's really great.
And the nice thing, most insurance plans cover it also.
Excellent. So for more information about Essure, you want to go on thedoctorstv.com. Thank you so much, Dr. Mayer and Dove. And coming up, another breakthrough for an embarrassing problem affecting women.